sit to stand is very, very important in terms of gaining functional independence, right? So a lot of research has shown that there is a very strong correlation between independent sit to stand and risk of falls, of ambulation speed, of discharge location, right? Sit to stand is actually one of the most challenging maneuvers to do. But we as therapists, I find, often put sit to stand as one of the first functional goals that we want our patients to achieve, which is a little bit difficult for our patients, because if you think about it, maintaining standing is easier than going from a sit to stand. But we're very focused on first achieving that sit to stand before we start working on standing and before we start working on ambulation. You actually require more range of motion and more joint torque to do a sit to stand than you do for stand, for ambulation, or for stair climbing.